There's an unacceptable number of patients who are admitted to hospital each year and even more importantly dying each year from asthma.
And when you look at asthma admissions in detail, in our hospital about 80 adults a year from this CCG are admitted and 1 or 2 people die from asthma every 2 or 3 months.
We have a lot of patients on our books who aren't properly treated.
All my life I've had an asthma attack, then it's been treated. I've tried to look after my asthma and it's gone downhill.
We could optimise patients' asthma treatment in the community and therefore try and improve control of their asthma and stop them coming to hospital.
What I want to do with this project is to make sure we turn patients from being passive recipients of healthcare into active participants.
The main objectives of the joint working programme, as I saw it, were to get all different healthcare professionals who are dealing with adults with asthma in the community, in primary care, both doctors and nurses, together with the secondary care doctors and nurses, with the help of a pharmaceutical company helping facilitate us working together, really drive better integration between all of us. It's something the NHS is not very good at.
Every single practice was providing an asthma care which is their own asthma care but not consistent practice. So we needed to standardize this so patient at any given practice will receive the same standardized care within the agreed protocol.
When we looked at our respiratory medication, we found that there were 2,700 patients who were on asthma medication without a diagnosis.
We also found patients undertreated and patients who were being overtreated, and we wanted to streamline all these treatments so that everybody was on the correct medication and receiving the best possible care.
We nominated 18 clinicians across 18 practices.
All the health professionals and actually some of the patients came together and we did some process mapping. We found, whilst doing the process mapping, huge holes in the care that could be improved.
We had all our nurses and doctors educated, trained, supported during the project, and it was totally patient-focused.
We as a team saw a remarkable success, the most obvious being the drop in attendances at the hospital and admissions by asthma patients, which fell by 21%.
Lots of treatment was changed, including patient education and how to manage their own asthma themselves more effectively.
The patients were really pleased with their management. They were pleased to be involved in their care.
I attended the asthma clinic. I was given an asthma management form and it helped me really be in control of the asthma because I knew exactly how to take the medicines if I was on the right medicines.
We had 38% of improved patient satisfaction. These are real large numbers and this couldn't have happened without the project.
I think that tells you that with relatively simple interventions in asthma you can lead to big improvements.
We can really integrate primary, secondary and community along with the private sector to deliver the best outcomes for our patients. Working with AstraZeneca showed us that they brought the professionalism into the project management that we needed in order to deliver the projects that we wanted to on time and with the right results that we were looking for.
Working with a pharma company, working with people who don't live their lives through surgeries and hospitals, that was quite refreshing.
There's still some cynicism amongst healthcare professionals about working with pharma. My experience is that in an open joint working agreement, everyone is a winner, particularly the patients.
I feel now on a daily basis that I am now in control of the asthma and the asthma isn't running my life.